Item 3 is Hennepin Highlights. Today's Hennepin Highlight is about safe sleep for infants, and Commissioner Higgins will introduce this presentation.
Thank you, Mr. Chair. Today's Hennepin Highlight features current research in Hennepin County that finds many previously unexplained infant deaths are accidental as a result of hazardous sleep environments. The HC Safe Sleep Initiative was formed in 2010 to study the cause of infant deaths in Hennepin County and determine ways in which large-scale education could occur. Dr. Andy Baker, Hennepin County's medical examiner, and Karen Adamson from HSPHD are here to fill us in. Dr. Baker. Oh, sorry.
Thank you very much, Mr. Chair, members of the board. It's a pleasure to be here today. We have a few minutes to talk about some initiatives we've taken in Hennepin County to promote safe sleep for our youngest citizens. Several years ago, a multidisciplinary committee was formed in Hennepin County to address this very problem, and I was asked to be part of that committee and also supply the data to the committee that would not only show the magnitude of the problem we have, but the kind of environments in which we have infants dying in Hennepin County. The graph that I'm projecting here is actually national data that goes through the year 2010 in the United States, and this is the number of total unexplained or accidental infant deaths in the United States on a year-by-year basis. You can see that there was a point in the early 1990s where our infant death rate plummeted, and that is because that's when the American Academy of Pediatrics introduced the Back to Sleep campaign, and I'm sure everybody in this room who's a parent at or around that time remembers when it suddenly became that was one of the most important things you could do as a parent, was put your child to sleep on her back. Sadly, since the late 1990s, we really haven't made any additional dents in the number of infant deaths occurring in these circumstances in this country. And this is getting a lot of press, the circumstances under which infants die, sometimes at daycare, more often at home in the care of their parents or caretakers. So I formed a team that involved not only Hennepin County employees, but the University of Minnesota and HCMC as well. And we went back and took a really in-depth look at all of our infant deaths in Hennepin County over a 5-year period to see what the magnitude of our problem really was and the circumstances under which these infants were dying. And I'm going to show you a couple of examples of the scenes that are very typical of what my investigators go to when we get called to an apparent unexplained infant death. Here you can see a crib in this photograph. It's unfortunately been rendered unsafe because undoubtedly well-meaning parents have placed a number of adult pillows and blankets in that crib. And when you look at this doll reenactment, which is kind of the industry standard for my investigators, you can see immediately what happened to this child. A similar circumstance is an example, this bassinet you see here, where, again, undoubtedly well-meaning parents have taken an adult pillow and put it in the bottom of that bassinet, making that surface far too soft for an infant to be sleeping on, and a child accidentally suffocated in that bassinet. This is another one of the scenarios that we know is very unsafe for infants, and that is sleeping either alone or with an adult on a couch. Here's an example of an infant who is sleeping on an adult bed. The bedding is far too thick. You can see the infant has been placed face down. The infant's airway is now occluded by the pillow that you see in that photograph. This, again, is a doll scene reenactment. This is what my investigators are actually doing with the caretakers when they go to the scenes of these deaths. We do get infants who are also inadvertently knocked off of beds during the night, and they get trapped or wedged between the mattress and the adjacent wall. And this is a very tragic example where an adult is sharing a bed with a child and unintentionally rolls over on that child in the middle of the night and wakes up to find the child has suffocated in that environment. What we often find in scenarios like the one you're looking at right here is, in fact, the caretaker did have access to a safe environment. In this case, it's a bassinet, but they're using that bassinet for something other than the infant's sleep. So those are just some examples of the things that we see on a regular basis in Hennepin County. This is the actual data we generated from the 5 years that we looked at. You may be shocked to learn that we had 84 infant deaths in sleep-related environments in a 5-year period in Hennepin County. That is not unusual for a county our size, and the data that I'm showing you are very typical when I compare them to other large jurisdictions. Probably the most important thing you can take from this slide is if you see the two peaks on your left, those are adult beds. The smaller peak is infants who are sleeping on adult beds alone. The larger peak is infants who are sleeping on an adult bed with one or more other people. Those explain the lion's share of most of our infant deaths in a sleep-related environment. These are the current recommendations from the American Academy of Pediatrics about where infants should be sleeping. And hopefully all new parents hear this from their pediatricians or their primary care physicians or their nurse practitioners when they leave the hospital. And that is, babies should always be sleeping on their backs. We've now been promulgating that in excess of 20 years. Babies should sleep in safety-approved cribs or bassinets only. Babies should share a room with their caretakers, but not a bed with their caretakers. No extra bedding should be in the baby's sleep environment. There's no need to put extra pillows and blankets in there for newborns. And, of course, smoking, alcohol, and drugs should be avoided. And so that's my part of the presentation, was to lay out the magnitude and the scope of the problem. And I think Karen is now going to address some of the things we're actually doing to try to prevent these.
Good afternoon. I'm Karen Adamson. I'm a program manager in maternal child health and early childhood, and I'd like to talk a little bit about the work that we started to do in response to Dr. Baker's research, as well as the work of the Child Mortality Review Team. In 2010, we did develop, as Dr. Baker was mentioning, the Safe Sleep Initiative. And this was really the first time, I think, as we've said, safe sleep was not a new idea for folks within our county or within our state, but this was really the first time that stakeholders within Hennepin County came together to really make safe sleep and the education of residents within Hennepin County a priority. All of the folks that were working with us were people who are working with families in some way, with infants on a daily basis, and we really saw this as an opportunity to make a difference in the way we were educating families. We started really very generally in terms of outreach fairs at the Government Center as well as Century Plaza, and certainly got interest from a variety of folks in the public as well as some of our staff. We developed a partnership with the Minnesota SID Center, and Kathleen Fernbach and myself did some presentations to some community organizations, as well as really looking at our Hennepin County homeless shelters. We found that families that were coming there with infants didn't necessarily have a safe place for the infants to sleep. So using some of our TANF funds, we were able to keep the shelters stocked with pack-and-play cribs, which we make available to the families and they take with them when they leave. But the one thing I think that was really the most important thing that we realized was that our very best resource is our staff. We have so many staff who are out in the public seeing families with infants on a daily basis that we realized that one of the best things we could do was really prepare them to educate the families that they see. And so as we were thinking about ways in which to do this, we were also considering other populations. Not all infants are being cared for by their parents. They are cared for by child care providers, foster parents, babysitters, grandparents. And so we needed some tools that were really available to a variety of folks within Hennepin County. We developed two things, and we're really quite proud of them. In 2012 and 2013, we developed a video. This is about 4.5 minutes in length and is available on the Hennepin County website. It's very general but complete information about safe sleep and safe sleep environments, and we hope that as it is linked to other websites within our total Hennepin County website, that folks are able to access it and use it. The other thing that we developed was really more specifically for our staff. We realize that as staff come into Hennepin County and begin to make visits in people's homes, that they aren't always aware of all of the information they need to educate families. So we developed an e-learning module, and this module is available through Apex for staff in HSPHD. Many have already started to use it to begin to make sure that our staff, when they're out in the public working with families, that they have the proper information to educate them on safe sleep environments. In addition, Hennepin County participates with other counties within Minnesota for the Minnesota Infant Mortality Reduction Project. This addresses safe sleep within the state of Minnesota, but it also looks at the significant disparities that exist in this area. This is also tied into a national network through the CDC. So I think we've made some progress. We certainly, as you can tell from the information that Dr. Baker shared, it's a compelling issue, and we continue to work on this, hoping that we're able to share this information with as many families as possible in Hennepin County.
Great. Thank you, Karen. Questions?
Mr. Chair,
Commissioner Callison.
are there numbers showing, excuse me, do the numbers show any results? Are you seeing a decline in the number of infant deaths as a result of this initiative?
Dr. Baker.
Mr. Chair, Commissioner Callison, that's a great question. We haven't gone back and rerun the numbers yet because so many of these initiatives are so new. The numbers are small enough. I mean, the number is tragically large, but at the same time, the numbers are small enough that it would take several years of data for us to tell if we've actually made a statistical decrease in the number of infant deaths, because there's going to be a little variability just from year to year, just because that's how things move. But we will absolutely come back and look at these data again in 3, 4, 5 years and see if we've made a statistically significant difference.
Great, thank you.
Anything else, Commissioner McLaughlin?
So has the instructions, the short video, what was it, 4 minutes long, the instructions to parents, has that been tweeted out to the world? And
Commissioner McLaughlin, I'm not sure, but we certainly can see about that. I don't know if it's on YouTube yet either, but
it seems like, that's another place to go, and we need to take advantage and try to, when we do these videos, and then they're kind of in a can someplace or in our own on our own webpage, and that's not how people are accessing things
absolutely.
today. So I hope you could
Oh,
get
actually,
that.
it's right here on Twitter.
It's on Twitter.
Oh, good.
Did
Yeah.
you?
Hennepin County just did it.
Okay. Right there.
Good work.
Right there.
Now
for instance?
retweeting, yes.
That's right.
There you go.